So, talking about women's health, we've already spoken about it. Our pelvic floor, it goes through a lot in a woman's lifetime. Periods to childbirth. Talking about childbirth, what happens to the pelvic floor after childbirth? And we hear a lot of this term, diastasis recti. Can you elaborate on that, please?
Yeah. So I like to see patients during their pregnancy
Okay.
so I can teach them good body alignment. I work with them a lot of times, when we're pregnant, our hormones are on alert. And so our joints are really lax, are very, unstable. So some of my patients will have SI joint pain, sacroiliac joint pain. And so I may put them in a SI belt or a pregnancy belt. And so I try to start before they deliver the baby. And then about 37 weeks, I go and I do an internal exam and I teach the patient and her partner how to stretch the perineum to avoid any tearing. So we work on getting the perineum ready to avoid any tearing. And then they have the baby. And I try to talk to them about delivery positions, those kind of things. Because if you've got a patient on their back and you've got dad on one side with the hip flexed and you've got mom on this side and she's pulling the leg, but they're not pulling the same, they're going to make some problems with the pubic symphysis in the front. So I have to work on that a little bit and try to teach them not to do that so that during delivery, they don't stress that front joint, the pubic symphysis joint. So then they have the baby. And then
Hmm.
I usually see them 2 weeks after delivery. Ask them to bring the baby with them and I will check alignment. I'll check then I'll check during pregnancy too, but especially after pregnancy. I want to check to see if they have diastasis recti, which means the fascia, it splits. So you can go down and you can feel if there's any splitting or and how deep it is, how wide and how deep. Sorry, I talk with my hands, as you can tell.
No, that's
Uh,
yeah, that's
so what I do is to work with them on bringing that fascia back together and doing exercises to keep that from getting worse.
that's amazing. See, for my understanding was that this is a type that happens after childbirth, like after
Mhm,
pregnancy.
mhm.
But I did not know this was something we could work on prior to childbirth and all the way through your pregnant, even during your
Right.
pregnancy.
Right. So I work with them on breathing and how to engage their abdominal muscles during, their transverse abdominals and the rectum, just during pregnancy also. So,
That is so great, Genia. Like I said, all that information we have about pelvic health has been so superficial, and I'm learning plenty.
right. Right.
Yeah,
Well, yeah, before, and even with when I had my 4 children, you just didn't get this information.
right.
You were just kind of on your own. And then at 6 months or 6 weeks after the pregnancy, it was like, okay, you can have sex again. Well,
Mm,
the problem is there's things that can happen between birth and 6 weeks. So that we can prevent. I had a patient that had a pubic symphysis issue with pregnancy, and I got her in right away, and I could examine her, and her leg length wasn't off. So, I mean, her everything was in place, but she just had so much pain from that. And what I taught her was keeping her legs together. You don't ever want to pull your leg out. So keep your legs together when you're getting in and out of the car, in and out of the bed, some different ways to stabilize that. And it really helped with the pain.
yeah, that's a very simple and effective tip, something that you can do in
Yes,
your
right.
everyday life. Yeah,
Right. Instead of having to wait till 6 weeks and go in and say, hey, because again, as you know, as a mom, if you're not feeling good, it's really hard to take care of your baby, because we're
exactly.
putting everything into the baby and nothing
Hmm.
into ourselves. So that's one of the things. And I helped write some legislation that's in Congress right now.
That's
It's
amazing.
it's HR 74. It just had a Senate bill. I can't remember the Senate bill, but it's focusing on postpartum health and
Wow.
especially in our Medicaid population. And the legislation is to encourage providers to know what pelvic health is and the benefit of public health, and then to educate the public and women on this is why it's important for you to get postpartum care.
Oh
So,
my God, this
so
is
yeah,
amazing. Thank you so much for doing
yeah,
that on behalf of
yeah,
all the women, if I
yeah,
may say so.
yeah.
That is so much needed. And even this episode today that we're talking about right now, like I said, yeah, all that information that's there about pelvic health is so superficial, but nobody really realizes how it affects from childhood through your entire life, to be honest.
Right, right.
Thank you so much. I'm excited and I'm going to be following up on that.
Yeah, yeah. I was just in Washington, D.C. actually last month on Capitol Hill, meeting with legislators and promoting 4074. I'm excited. I hope it gets passed this year, but it's a little
Me
crazy in the
too.
government now. My priorities aren't really maybe their priorities for some, but I think it's amazing though. So we're trying to do that focus on education for both the patients and providers.
Like I said, a strong
Yeah.
advocate, at the national
Yeah.
level. We have
Yeah.
it.
Yeah.